Welcome back once again for another episode, and this time it's going to be special. Why? Because ang mga ka-VNVs nyo ngayon ay very socially responsible.
Yes.
Yes. So bakit? It's because we have a special guest who is an ABA specialist. So mamaya malalaman natin anong ibig sabihin
Yes.
nun. Yeah. Without further ado, let us all welcome Miss Rose Cayena from MABC Abilities Development. Nakakatuwa kasi this episode we will talk more about your children, our
Yes.
children, right?
Yes.
And we're so happy that you are here with us. You know, like someone who knows children more than
Who
us.
is
perhaps.
expert in this field and
That's
to
right.
give us talaga, to
Yeah.
educate us.
That's right.
Yes.
So expect learnings from this episode. So yeah, let's start.
So can you please explain it to our viewers? What is ABA and what do you do as a therapist?
Yes. Okay. So I am an ABA therapist or applied behavior analysis therapist. So we use the concepts of ABA to help children with developmental, cognitive, or learning disabilities. So that will address communication, social, motor, pre-academics, and group and classroom skills. So yeah, those are the areas.
Speaking of behavioral, yung developmental, usually kasi ang ano dyan lagi ng mga parents, yung paano ba malalaman if my child
Yeah.
is hitting the milestone, if my child is normally developing, and then when is the time na we'll raise the flag na I think my child needs help.
Yes. Okay. So that's a very good question, kasi some parents talaga, they are confused. Ano ba, hihingi na ba ako ng tulong or it's okay, baka ma-overcome lang nung bata. But generally, you wanna look into kung ano yung lacking at saka kung ano yung excess doon sa bata. Okay? Now, commonly, yung mga developmental disabilities including ASD, meaning Autism Spectrum Disorder, and also ADHD, these are developmental disabilities. They affect the communication, yung pagsasalita, pagko-communicate ng bata. Alright? Social skills, and they also exhibit repetitive at saka mga restrictive movements. Alright? So, balikan lang natin doon sa lacking at saka excess. Lacking, may kulang. Okay? So, children, from the very beginning, meron na silang development sa communication. So, babies up to 11 months, dapat they should be bubbling. Okay? Mama, dada, ua, like that. And babies can also show like exploration of the environment. So, pag pinakitaan mo yan ng toy, their face light up, or they will wanna try to, reach that one out, okay? Or pag nilagay mo yung baby sa floor, they will try to roll and, crawl. And then also they express the need and the want to interact.
Right.
Okay? Like when they see our face, their parents' face, di ba they smile?
Yeah.
Right?
Beam yung eyes.
You're
There's
right.
something na parang
Yes.
spark.
Yes. And
Yeah.
sometimes yung babies then, pag matagal na siyang walang attention, they would cry like, they wanna, have an interaction. They want to have attention.
Right.
So generally, you wanna check on kung ano yung lacking at saka excess sa development ng mga anak natin. So, for example, commonly, yung mga ASD or what we call the Autism Spectrum Disorder at saka yung mga ibang developmental disorders, they affect yung speech and communication ng bata. Okay, social skills, and also they exhibit yung mga repetitive at saka mga restrictive behaviors. Okay? So, ano sila? Intense interest in sameness, same toy, same clothes, same routine every day, or same places, ganon. So, kaya minsan nagkakaproblema sila pag naiiba na yung lugar, naiiba na yung schedule, ganon. And then, so going back doon sa lacking at saka sa excess, so for 1-year-old, dapat nakakapagsalita na yung bata ng one word. Okay? So, commonly, mommy, daddy, milk, school,
Sleep,
book, yan. Oo. Tapos, nandun pa rin yung pag-i-explore nila ng environment at saka yung kanilang desire to interact, right? And then, also at 2 years old, 2 words na rin dapat. Okay?
Okay.
So, eat bread, drink milk, go play, ganon. Yung iba pa nga, matatas, I don't want. Okay? Yung mga ganon, di ba? At 2 years old. So, andun pa din yung pag-i-explore nila at saka desire to interact. Ngayon, pag lacking, ibig sabihin, at the age of 2, wala pa rin siyang language. Yes. Or, ganun lang. Or minsan magtuturo lang siya or kukunin ka niya tapos may papagawa siya sa'yo. So, that's lacking. Kasi 2 years old na siya, di ba?
Yeah.
And pag excess naman, you might have seen some kids na nagpa-flap sila ng hands nila, okay? Or
Pero pa nga nagra-rock yan.
Nagra-rock. And then,
repetitively din yun.
yes, and also yung iba, magba-back and forth sila. Tapos meron silang sinasabi na, or they just say something that's repeatedly. Okay? And then yung iba, meron silang mga eye or tsaka facial movements sa paulit-ulit. Ganon.
Tapos yung ano daw, pag may toy, tapos
Nila-line up.
iniikot yung
Yeah,
wheels.
that's steaming. Yan naman is self-regulation yun. Yes.
So kung baga sa parent na nanonood right now, so ngayon alam ko na. So na-pinpoint mo na what are the excess and lacking sa child. So as your center, what do you offer to cater to these kinds of
Yes.
disabilities?
Right. So, if in case they feel the need na kailangan ng help ng child nila, they can approach behavioral centers, okay? Or yung doctors for children, like neuropedia or the regular pedia or the psychologist, okay? Now, ngayon naman sa center namin, we offer ABA or behavior therapy, okay?
So what is behavior therapy?
Yes.
So, ABA, Applied Behavior Analysis, alright, this is the science na tinutulungan namin yung mga bata to develop in their milestones, okay? Titingnan natin yung communication nila, social skills, group skills, motor, visual, perceptual, early academics, and also mga behaviors na pwedeng nagiging barrier nila sa kanilang pag-develop at saka pag-learn. For example, meron silang mga non-compliance, yung ayaw makinig, or mga sensory issues, or motor problems, ganon. So, tinitingnan din yun namin in terms of assessment.
So, dapat talaga pala, holistic yung approach, no? So, they will just come from the doctors, like them.
Yes.
They will be the one to diagnose, right?
Yes. So, sa amin naman, in terms of ABA therapy, hindi namin kailangan ng diagnosis. Okay, you can come to us. We will conduct the consultation. We will do the assessment, and we can prepare a program and do the sessions, alright? Ngayon, kailangan mo lang ng diagnosis if, for example, kukuha ka sa insurance ng payments mo. Kasi insurance will require diagnosis, right? And of course, there are really parents na gusto nilang ma-pinpoint.
Yeah.
Right? I want to know exactly what's happening to my child. So, pupunta siya ngayon sa neuropedia or psychologist to clinics na makakapagbigay sa kanila ng diagnosis.
So say for example na I reach out to you, so I want my child to be assessed. So what can I expect from that session, and how many sessions ba? So yung time frame ng therapy. So
yun naman, that will depend in the case of the child, right? But the procedure namin is, first we do a consultation with the parents, okay? And during the consultation, I observe din namin yung bata. And then, after that, when the parents decided to go ahead with the therapy, magkakandak muna kami ng assessment. And then, after the assessment, magpe-prepare na kami ng program dun sa bata. Okay? Milestones yun. Kasali na yung communication again, and then yung motor skills niya. Lahat yung titingnan natin, kung ano yung excess, kung ano yung lacking. Tapos we will work on increasing and decreasing those para ma-hit niya yung milestones niya according sa age niya. Okay?
So yung program, yung sessions ba, ano yan specifically sa isang location, like sa center nyo?
Yeah.
Or can it be partnered with school or sa bahay?
Yeah, that's a good question. Kasi these days, actually, mas flexible na rin yung setup, ako personally, I've experienced working sa center, and a big part home. Yeah. And then ngayon, we're also working in schools. So, right now, we are focused on doing home sessions and school-based sessions.
Okay, so the school are welcoming when it comes to this. Pag in-inform yung
Yeah.
school,
Mm-mm.
they welcome yung therapist na can partner with them, and
That's
then
right.
paano ba yun? Nasa loob kayo ng classroom
Yeah.
while the class is being held.
Yeah, sometimes we are inside the classroom. Iraran namin, kasi depende yun sa program ng bata. So, iraran namin yun sa classroom or pull out. The school gives us a place to do the session itself. Yes.
So depends. Especially may mga shadow teachers itong mga estudyante na to.
Yes.
I mean yung mga
Yes.
children.
Actually, yan yung common lang na ginagawa ng ibang parents, di ba? They only seek for shadow teachers para lang matulungan yung mga kids nila
Yeah.
to cope with the assignments, yung mga activities sa classroom.
Yeah.
But it's important pala na to partner with the therapist.
Kasi no offense meant naman. Kasi ang mga shadow teachers, hindi naman sila trained for this types
The
of
behavior
children, or the
part.
behavior. Yes, that's why, yeah.
More on academics.
They play an important role to this
Yes.
types of.
So part naman kasi ng ABA therapy namin, kami in our center, is we do parent training at saka shadow teacher training.
Okay.
Okay, so some of the parents that we work with, they request their shadow teachers to be in the session. Mag-observe sila sa amin. Okay? And then they will also, for example, may problem behavior sa classroom. So, kinukonsult kami ng shadow teacher and then titingnan namin kung paano yun piniprevent or paano mo siya i-address.
Okay.
But I think in my opinion, the role of the parents is the most important, more significant in these types of cases, right?
Yeah, it's actually a very important role. May role talaga ang parents kasi yung parents ang madalas na kasama ng bata.
Yeah.
At saka dapat din yung parents ang one of people na talaga makaka-manage ng behavior.
So since you mentioned about parent training, shadow teacher training, and then the therapy session, so how can they reach you? If the parents are watching us right now, I'm sure if they're decided na they pinpoint kung ano yung need ng anak nila. So now, how can we reach you and get the assessment?
The MABC abilities.
Yes, so our center is called MABC Abilities Development, UAE. So yeah, they can DM you guys and you can refer us to us, or if they can also find our FB page, which is MABC Abilities Development. Actually, we are going to give free consultation, right?
So mga ka-BNBs.
For the first five.
For the first five.
First five.
Okay, so what are we gonna do? They're just gonna DM us. So the first 5 people to DM us will get a free consultation with MABC.
Yes. And we would just like to know na they shouldn't be scared to reach out, to seek help.
Yeah.
Okay? So, for those parents na medyo nalilito pa, na still on that stage na, pinifeel pa nila yung condition ng bata, wag na nilang isipin kung ano yung mga disabilities na meron, or they should not think anymore about autism, but just looking at the child na meron siyang pangangailangan na help in one area.
Even if it's just one.
Yeah. Kasi actually, the ABA or any other therapist, hindi naman kailangang may disability yung bata developmentally. Okay? What if delayed lang siyang magsalita? Kailangan lang talaga niya ng training. Right?
Therapy.
Yes. And also, kailangan lang niya ng social skills. Kailangan lang niya ng compliance skills. Yung mga ganun. So, we can train them with that. Okay? So, they shouldn't hold back in seeking help kung kailangan ng anak nila.
Kaya to those parents who are still hesitant, and kasi nga, di ba, before tabu siya.
Yeah.
So, right now,
It's
iba
so
na yung generation. Iba na yung panahon
It's better to
ngayon.
seek help early. Sabi nga, early intervention.
Oo, to avoid further delay. Kasi, I mean,
ang mas mahihirapan yung bata compared sa
Yes.
Huwag pahirapan yung mga bata.
Yung bata, and of course yung parents din. Kasi pag lumabas kayo, okay? And or pag nasa school, nasa community, di ba?
Yeah,
Kaya,
yung stress din nasa parents.
Yes. Kaya nga actually, with our parent training, minsan pumupunta kami sa barbershop or sa mall, alright? In the grocery. Just
para yung mga different scenarios.
Yes, para part of our training the parents kung paano ma-manage yung behavior din ng bata. Matulungan natin sila, ano?
Interesting.
Mm-mm.
Di ba? Kasi baka akala nila at the comfort of their homes or sa school lang. But this time,
Anywhere.
Yes.
Kasi anywhere
Yeah.
pwedeng mag-meltdown yung
Kasi ang
bata.
interaction naman ng bata, whether normal or yung
Kahit saan.
may spectrum,
Yeah,
everywhere.
yes.
Kasi part sila ng community.
Yes, yeah. And us also, as like titos, titas, and us,
Yeah, the people around the family
Yeah.
na
yeah, we can also be a support system.
yeah,
Mhm.
and
Okay, so first and foremost, we want to stop being judgmental.
Yeah.
Yes,
Okay.
most important.
Yes. So, but instead, we should help the parents recognize or mag-clarify sa sarili nila kung ano yung mga help. So, instead of going in na, uy, alam mo, parang may problema yung anak mo sa ganyan. Alam mo, ipa-check up mo yan, mga ganun agad, di ba?
Oh,
And they have to be sensitive.
They have to be sensitive. Oo, kasi hindi rin naman madali yun sa family. Just gently say na, parang he needs help or she needs assistance in terms
in this
of,
area.
do you think you notice that? Ganyan. So if the parent says na, oh yeah, actually, napansin nga namin na ganyan. So what do you think, did you think of any steps na para ma-address, ganyan? Ay, iniisip ka namin pero parang hindi pa namin alam. So alam mo yon, napoprobe mo yon, and then the parent is also thinking to herself,
Nagiging na rin siya. Parang nagkakaroon ng confirmation sa...
Yes.
Mali mo, may doubt siya.
Na-entertain niya na yung,
denial.
kasi hindi lang pala siya yung nakaka-observe.
Yes.
May yun din
Correct.
palang tao
Yes.
sa paligid.
So natutulungan din natin sila to recognize.
Yes.
And also, kumbaga, hindi maging defensive
Yes.
si parent,
Do you have any awareness, let's say posts or something on your Facebook page?
Yeah.
More information.
Yeah, more information about this.
Yes. Actually, in our Facebook page, you will see the services that we have. And also, even there, my description ko ano po yung ABA therapy. So, if you go to our page, you will get understanding of the therapy itself, kung ano yung mga areas na pwede namin kayo matulungan, mga services namin. Ganon.
Alright.
So we can put in the comment section yung kanilang
FB page,
siya.
to know more about them.
That's
Yes,
right, to know
yes.
more about. Hopefully, this episode encourages our dear parents out there, and and if you are, please don't forget to leave a green heart on the comment section.
Maraming salamat for
Yeah.
giving us the chance to know more about the center, and as well as the awareness on how we should really parang i-observe yung aming mga
Yes.
anak, diba? So this is something that we as
We need to
parents, we really need to talk about it. And there's nothing wrong if something is wrong, if you feel that there's something wrong with your children, to seek for help. And there are so many centers already, and MABC is there to really help you in the development of your children. They are heritage from above. They are gift from God. So we have to take care of that gift. And the best thing that we can do is we give back to God kung ano yung binigay niya sa atin with yung responsibility natin as parents. So yun lang. So
Yes.
maraming salamat ulit.
Thank you also so
Yeah,
much.
Thank you
It's
so
been a
much.
pleasure.
Yeah, thank you so much for your heart of service, for being passionate
it's a
about
calling.
Yes.
these beautiful children. And of course, we look forward to hearing from mga ka-VNVs
Yes.
natin. Thank you so much once again for being with us in this special episode. Once again, thank you, Ms. Rose. And yes, we look forward to see you on our next episode right here on Voices and Views.
Thank you so much.